what I want to discuss when talking about couple sexual problems is something that has received a lot of commentary and popularity in recent months. Now, I've done several interviews on this topic. I'm not sure if they've been published yet or not, but the issue is that of a clash of sex drive. This is known as mismatched desire. This is when one partner in the relationship has a higher sex drive than their partner. And it happens to be the most common problem that couples present with in sex therapy. Of course, this is the number one issue, right? When you think about mismatched desire, what do you think about? You think about one's partner's desire for sex is stronger than the others. And that's basically correct. You may also think that this is normal and obvious that one partner may want to be more intimate than the other. And this is partly true as well. Our sexual desire is subjective. What is a lot for one person may not be a lot for someone else. Our desire is influenced by culture, by environment, by our ethnicity. All of these things play a factor in our sexual desire. So if you think, well, hey, every day is a lot, or you think once a week is a lot, or once a month is a lot, all of that is completely subjective. And our sexual desire also fluctuates over time. Each of us have had times and periods in our lives when we want to have more sex. And there's other times when we're not as interested in sex. This could be because of the state of our relationship. It could be emotional factors. It could be that we're dealing with grief or loss. There could be physical or health issues that we're encountering. We could just be extremely busy or extremely tired. And of course, aging can also be an issue. So this is relatively normal and natural to have this fluctuating sexual desire over time. And if you're listening and you're like, wow, last month I wanted sex nonstop, and then for the last 2 weeks, I don't know, there's just something wrong with me. Don't worry, that's perfectly normal. It's very natural for this to happen. Many times, though, your partner's desire may be different than yours. They may be really in the mood during the times that you're not, or vice versa. You might be really in the mood during the times that they're not. And this too is normal. And a lot of couples deal with this in very healthy ways. They discuss it, right? Basically, they sit down and they decide when they're going to have sex and how often, and perhaps seek for some type of compromise. There are couples who deal with this mismatched desire in very unhealthy ways. They could be begging their partner or somehow manipulating their partner to convince them to have sex, or just fighting about it. All of those are really unhealthy, and they're not good in any way for your relationship, nor are they good for you nor your partner's mental health. Now, when we talk about mismatched desire or sexual desire discrepancy, what we must consider is the discrepancy that's taking place between one's desired frequency of having intercourse and one's actual frequency of having intercourse. So what that means is you may desire to have sex 5 times a week, but you're only having it once. And if you're listening, and if you've listened to our show on men's sexual problems, you may remember that hypoactive sexual desire is diagnosed when a man reports that he never or almost never has sexual fantasies, engages in sexual activity, or masturbates. And as I stated, A diagnosis is only given if the person presents themselves as having a problem, meaning that this lack of desire is causing them distress. So, for example, if a man has low sexual desire, it is not diagnosed with hypoactive desire disorder if he is okay with it. If only his partner is complaining about it, but he has no problem, then it's no diagnosis. He's not in any distress. For mismatched desire, both partners have to experience distress about the situation. So this really makes this a couple's sexual issue. And that's what distinguishes mismatched desire or this discrepancy disorder as opposed to an individual sexual disorder for a male or a female.